are checking the pulses, we also want to look at the neck too, make sure we don't have any jugular vein distension in that. So that concludes our respiratory and cardiac assessment. When we also do this with females and males, we want to ask about breast exams to see if they do monthly breast exams or if they have any abnormalities. So Miss Lori, have you had any problems with your breasts? Any pain, redness, dimpling to the skin, any discharge, have you noticed?
No, I have not.
No? Okay, do you do monthly breast self-exams?
No, I don't.
No? Okay. Have you been taught how to do those?
No, I haven't.
Okay. Well, we're going to go over that today with you, just so it's really important to do monthly self-breast exams, just because we want to catch if you have any abnormalities sooner than later. It's best to do your breast exams after your menstrual period, because sometimes in the days leading up to that, you have some swelling, some tenderness. So it's best to do it a few days after. So the first thing you're going to do is stand in front of the mirror topless. You're going to want to put your hands on your hips and just kind of look at your breasts in the mirror. You're going to make sure they look the same on either side, that they're symmetrical, that there's no drainage coming from your nipples or anywhere on your breast. Also look for any redness, swelling, lumps that you can see, like dimpling of the skin, kind of looks like an orange peel. Those are all things that you need to speak with your doctor about.
Okay.
So then when you do that, you'll also raise your arms above your head.
Okay.
Look at the same thing, because sometimes you'll see changes in that too when your arms are above your head. So then you're going to use 2 fingers. It's best to use your right hand to examine your left breast and the same left hand to do your right breast. You're going to want to use your 2 fingers kind of at a flat area. There's different ways you can do it, either in a circular motion or just kind of palpate with just the fingers.
Okay.
When you do your exam, you want to make sure you include the armpit. So armpit all the way down to like your ribs here, underneath your breast. And then from here all the way to your cleavage, okay? Like your sternum area on either breast. And you're going to want to feel each one. So you'll take your fingers. A lot of people like to do it laying down at first, with arm behind your head, kind of get easier feeling. You can start at your nipple and work your way around, covering the entire breast. And you'll want to use like small circular motions.
Okay.
You can also palpate starting at the top and going down. You'll have to, of course, press a little bit harder for the deeper tissue.
Okay.
Once you do that with both breasts while you're laying down, you can also do it in the shower. Just like people like, it's more slippery and easier to feel. So you want to do it laying down and then standing up as well, feeling around your whole breast, front and back. And you should do that once a month. Okay? Do you have any questions?
No, that's great. Thank you.
Okay, you're welcome.
Thank you.
The doctor will be in to see you.
Thank you.
You're welcome.